Long-term care is the topic of much discussion because every day medical advances create more and more opportunities for us to live longer, and that's good news. But when you don't die, you live, and when you live, you grow old, and when you get old, you get frail and sick, and when you get sick, you need care. Living a long life is a near certainty. Planning for it is now a necessity. Hi, my name is Linda Thalheimer, and I'm a long-term care insurance specialist, and I've been specializing in long-term care insurance for over 14 years. As an occupational therapist with a master's degree in healthcare administration, I worked in healthcare for 16 years. And every time a patient came in with a new diagnosis or a new illness, they were always surprised. No one ever expects to need help, and almost everyone wants to stay in their own home, and that can be expensive. Long-term care planning is an essential part of financial planning. People will often think about long-term care in terms of themselves. Who will take care of me? But the question is not who will take care of you, but rather what caring for you will do to your family. And I use family in a very general way. 25% of baby boomers are not having children. So when I say family, I mean your family. And this means it could be your siblings, your nieces, your nephews, your best friends, or even your neighbors. The chance of needing a nursing home is about 43%. The chance of using an extended stay in a nursing home is far less. But the reason for that is that the vast majority of long-term care is in home care. And most care is provided by children, their spouses, and grandchildren. Long-term care impacts the family not only with the emotional impact of a loved one needing care, but also as a functional impact on jobs and relationships. Families often report lost income, missed career opportunities, even job loss, as well as increased stress with a partner or spouse. Long-term care responsibilities are difficult to share equally and can be quite expensive, burdensome, and emotional, and this can tear families apart. Clients will often tell me that they don't want their children to care for them. And most children don't want to, but they will. Others will tell me their spouses will care for them, and he or she will if he or she is still able. But please understand, providing care for a chronically ill person can make that caregiver sick, and then the children need to be brought back in because they need to know that their parents are safe. For people who don't have children, or children living too far away to provide primary care, these people will need additional funds to hire coordinators to coordinate their care. They will usually enter into a facility prematurely because it's just easier and feels safer. But private pay settings are very expensive. So I ask you to take this time to think about your plan, and that plan may include talking to your parents about their plans, because it works both ways. Do you want to care for your parents? And will you? But is there something you can do now that will allow you to honor your commitment to your parents while still having a quality of life when they get sick? There are 5 funding options for long-term care: Medicare, Medicaid, the Veterans Administration, self-funding, and long-term care insurance. Most people are surprised that Medicare does not pay for long-term care, but Medicare pays for primarily skilled, not custodial care. You can remember Medicare by the last 4 letters. CARE. Medicare is medical care. And it only pays for custodial care and home care when skilled care or rehabilitation services are in place. It pays nothing for assisted living, adult day health, and pays only up to the first 100 days of skilled care in a nursing home. Medicaid is the federal and state-funded program for the poor. You can remember Medicaid by the last 3 letters. AID. Medicaid is financial aid, and it is very limited in home care, adult day health, assisted living, and it typically pays for the one place no one wants to go, a nursing home. People are very surprised to the extent that one would need to spend down to qualify for Medicaid. The national median is just about $2,600 for a single spend down of assets, with a monthly income of only $60. Spouses' assets are also limited, and so is their income. And for those people who have second marriages and prenuptials, they provide no protection against a spend down. TRICARE is the veterans' health insurance. Like Medicare, it does not cover long-term care. Facility care is rationed based on service-connected disability and the ability to pay, and home care services are very difficult to access. Self-funding is another option. Most people who choose to self-insure do so because they don't want to spend the premium protecting their assets for their children. But if they do need long-term care, they leave their children a double-edged sword. Without a pre-allocated fund to pay for long-term care, the children now need to make the difficult decision, and often conflicting decision among siblings, of whether to provide care themselves or to spend down their inheritance. Others will choose to self-insure because they don't have children or a need to leave anything behind. However, this leaves them with an inconsistent situation as well. Without insurance, these people would need to save hundreds and hundreds of thousands of dollars just in case they do need long-term care to protect their choices and quality of care. With long-term care insurance, they can spend down their assets more completely, knowing that they have long-term care funds already allocated. If you know that you can pay for long-term care, then you have done well in saving and allocating assets to pay for post-retirement needs. During most of your life, however, these assets are being protected by other forms of insurance. Your car is protected by auto insurance, your home by property insurance, your family by life insurance, your income by disability insurance, and your wealth by more life insurance. But what is protecting your portfolio at retirement? The only thing protecting your portfolio at retirement is your good health. Long-term care insurance pays for custodial care. It's designed to pay for home care, adult day health, assisted living, nursing home, and hospice. And 50% of people over the age of 60 will use their long-term care policies during their lifetime. Life insurance and other forms of insurance protect your assets during the working years. Long-term care insurance protects your retirement portfolio so that it can be executed for the purpose for which it was intended. Unfortunately, long-term care insurance is not just needed by the aging, but many young people may need long-term care because of accident, injury, or illness. With lower costs of purchasing long-term care when young, long-term care insurance is an excellent way to supplement health insurance benefits which do not provide for long-term care costs. So what do you need to know about long-term care insurance? Long-term care insurance pays a daily or a monthly benefit for a benefit duration anywhere from 2 to 10 years. And you can have inflation protection, simple or compound. But most importantly, you need to be healthy to qualify. To qualify for the actual benefits, you would need assistance of 2 of 6 daily living skills, which include bathing, dressing, transferring, which means moving from one place to another, like on and off a bed, toileting, feeding, or continence. Or you would have a severe cognitive impairment that impacts your safety, like Alzheimer's. Now, the government provides significant tax incentives for people to purchase long-term care insurance. It's the only insurance product in which you can potentially take a deduction on the premium and still receive the benefit tax-free. In Massachusetts, we have the MassHealth lien law, which protects your Massachusetts home up to $750,000. And in 40 states, there's partnership, which protects dollar-for-dollar protection against Medicaid recovery based on the long-term care benefit. There are many riders for long-term care protection. For those people who are concerned about the flexibility or international coverage, there are cash benefits. For couples, shared benefit riders provide increased leveraging of their policies by being able to use each other's benefits or a shared benefit pool. For people who are concerned about purchasing a policy and never using the benefit, there are return of premium riders. And for people who are concerned about rate stability, there are linked products that provide guaranteed premiums. Why now? The cost of waiting is that you may have higher premium payments. But most importantly, you need to be concerned of the risk of becoming uninsurable. So I'm always asked, what does it cost? Premiums are based on your age, your health, your marital and partner status, and the benefit and rider choices. But there are really 2 ways to look at long-term care from premium. You can look at budget first, which is where you identify an affordable premium, and then we identify the benefits that would best meet your needs for that premium. Or if premium is not an issue, we look at the benefit first, and we leverage the maximum number of assets as much as possible. Long-term care insurance is about tax and succession planning. It's about special needs planning and charitable giving. It's about planning to keep financial commitments and securing the financial viability of a surviving partner or spouse. Now, I've shared a lot of information with you today in a very short period of time, so let me summarize very simply. Would you be surprised if you lived into old age? Are you surprised when older people need care? And we all know that care is very expensive. Long-term care insurance leverages your income and your assets, and with the added tax incentives, it makes it all the more valuable. But most importantly, long-term care provides a plan for the family. For more information, you can reach me at 617-201-2499, email at linda@longlifeplanning.com, or visit my website, www.longlifeplanning.com. Thank you.